Hello, friends. I'm Dr. Puja Kapoor, consultant pediatric neurologist, director and co founder Continua Kids. So, the topic of today's discussion is what is ADHD? So, what is ADHD? And in the next part, we would deal with how to treat ADHD. So, today's session would be what is attention deficit hyperactivity disorder. So, as you can realize that ADHD constitutes of two parts: attention deficit and or hyperactivity disorder. So, how are you going to diagnose a child whether the child has ADHD or not? So, any child who is running all around, you just cannot say this child has ADHD. So, a child who has inability to restrain himself in an environment where generally he should be restraining but could not physically, verbally, or in behavior, and which also hampers his other developmental domains, also hampers his ability to socialize, to communicate, to connect. That is the child who you will tell to have hyperactivity disorder. So that's a very long and a big definition. Let us simplify it, let's dissect it. So any child, so children are basically, they run all around. They jump from this place, they just go around, they go inside, on top. So they are all over. Children are curious by nature. As soon as the child starts walking by the age of 1 year, he wants to explore, he's curious, he wants to know what is happening, where it is happening, and then they will roam around because this is the nature, this is how nature has made him. But whenever a child is unable to control that impulsivity whenever it is required, or he learns, he damages himself, he knew that this is dangerous but still he just could not stop himself from doing that activity, is then what you called as hyperactivity. So a small child who's 2 year old will be just running around. As you go and as you grow older and you become 3 year old, he goes to school but he's not sitting. Teacher is saying, "Ye bet nahi raha hai." He's all over. He runs around. He moves from one desk to another. So generally, a child of 3 year old should sit for like 10-15 minutes on his table, concentrate whatever the teacher is telling. Suppose there are Johnny, Johnny, yes, Papa, or ABCD or whatever, they will listen to that for a period of 5 to 10 minutes, and then the activity has to change to get his attention back. But if the child is unable to do so at that speculated age, or when he grows up by the age of 5 years or 6 years, he talks incessantly. If I'll ask him, "What is your name?" He will say, "My name is this, my grandmother's name is this, my grandfather's name is this, I go to this school and this. And then I went there and then I fell down from there." So the story is never ending. He will just start talking, and when you will make him stop, okay, stop, count till 10, stop. And then if you are talking to the mother or the parent, in between again, he'll come back to you. And maybe that would be contextual talk or non-contextual too. That means if you were talking to mother and just asking him asking her in which school your child goes, and the child will say, "I go to blah 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 this school, and I have so many friends, and one day when I went to Sarojini Nagar market, I bought this." You know, he has to just speak, because that is his desire or his urge to speak. He will just speak without, irrespective of whether this is asked, whether this has any context also or not, but he will not be able to control his impulsivity. So there would be children who would just hit the other child at 5 years, 6 years of age. They will be running and then suddenly they'll just hit the other child and then they will say sorry. Sorry, the intention was not to hit, but the impulsivity was so strong that he tend to hit him. So this is how you describe a child who has got hyperactivity. And so later on, as they grow up, they are unable to complete the classwork. So the teacher says that in this amount of time, you have to copy this. But because they are so hyper, they are so impulsive, they just don't want to sit at one place, they won't be able to copy. But mind it, intelligence is absolutely normal. Means you will ask him why this happened, when this happened, he will be able to tell you everything. You'll ask him, where do you stay? Give me, tell me the rhyme, this rhyme or that story. And in fact, they will have abstract thinking also. They will self-made the story in very small little time. So that means the intelligence is normal, but in spite of having intelligence normal, because of the impulsivity, they would not be able to complete the homework or classwork. And that is the time parents comes to us. Ma'am, पढ़ाई नहीं कर रहा है, समझता सब कुछ है, silly mistakes करके आता है. He does silly mistakes and because of that, he doesn't score full marks. I know he's intelligent. I don't know why he isn't doing it. Why is he performing it? Because he does not have that concentration. He does not have that attention to write it. He does not have that amount of stability in his mind to write the full complete sentence, or in fact to read the full sentence. Maybe he'll skip 2 questions. So, oh, ये तो मैंने देखा ही नहीं, because I just came to question number 5 and then I moved to question number 7. And maybe at times he won't be able to just flip the page and maybe flip 2 pages together. And because of that, that just causes decrease in his scoring. In spite of being his intelligence, he's knowing the answer, he knew it, but he won't be able to reproduce it because he is in a hurry, he is unable to concentrate, he is unable to do it. Okay, so that is what you called as ADHD. And out of that ADHD, this is the hyperactivity component. So because of this, they are unable to make friends because they don't know how to react to some other's emotion because they are always in a hurry. You know, the clock is always ticking, tick, 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 tick. They just want to do something or the other. They are flickering, they are moving, they are just restless. And because of that, they are unable to make friends. So they don't have friends. So that is also one point. They will say, I'm not going to go to school. I don't want to go to school because the teacher scolds me for not completing the homework. I don't have any friends. Nobody tells me to play because if I am asked to play cricket, maybe I'll just jump over, take the bat and start just moving around. Maybe I'll take the ball and just throwing all around. I will not be able to abide by the rules of the games. And because of that, nobody wants to talk to him because he doesn't know how to behave. So I'm not going to play with him. And so slowly, this lands up into conduct disorder. That means because according to the child, he's absolutely fine. He does not have any concerns. He behaves because this is the behavior he knows and he doesn't see anything wrong in that kind of behavior. But because the parent sees it, ki jo hai, in spite of me teaching everything, in spite of him knowing everything, he still does not score, so he will be scolded. The school teacher will tell, ki, why don't you copy the classwork? Why don't you do the homework? He will get the scolding. Friends? No friends. So once he gets frustrated, he just developed that habit of, nobody loves me, the life is just hopeless and ruthless, I'm not interested in anybody, and that is once the conduct comes in. Maybe he'll start hitting, maybe he'll start lying, maybe he'll start stealing, maybe he'll just get himself out of the community, he'll just wanted to stay all alone, he does not want to connect with the parents because they don't understand, nobody understands him, and so he'll start staying aloof all alone. So this is how the secondary features landed, and at times parents comes to us at this stage. You know, that's very difficult. because the child has really lost interest in everything and he just wants to answer back, or even does not want to react to any scolding or any hammering or anything. Okay, so he may fall into any of the two domains. Now, so this is the first part of hyperactivity, which changes the stages. By age of 5, 6, 7 is the age when you have the maximum impulsivity. And then after reaching that, maybe slowly it goes down, 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 down. And it is said by the age as you grow to adolescence, 66% of the children who have been diagnosed with ADHD lose the tag of hyperactivity. And they have other issues. They may land up into depression or other thoughts, or they won't perform so well into their life. But, that impulsivity characteristic and all, they will lose. So, as you know that once you were a child, you were very playful, moving, running, but as soon as you grow old, you just want to sit together, and as you more older and older, you want to sit together alone. Just give me a second. So that is the normal course of any person. So as you grow old, you want to sit, you don't want to move, you want to be more quieter. And so with these children also, they become more quieter, more settled. They settle down as the age progresses, but they have, lacunae there. And because of that, they are unable to do or unable to use their intelligence, which is absolutely normal. So this was hyperactivity component of ADHD. There is one more component which you called as inattention. So hyperactivity is found basically in boys more as compared to girls, whereas inattention is found more in girls. And what would be the criteria for diagnosing inattention type of ADHD? So the child, again, the intelligence is normal, but once you will ask them to write, to read, so they will just, they will have just sit down like this and they will stare all around. They will look outside the window. They will know who is hitting whom, whatever is happening, what fly is moving from this way to this way, what flower the color is. They will appreciate the beauty of the flower, but they will not pay attention whatever in the class what is said. So if the teacher is telling you something, they will be more interested in a small ant which is there on the wall moving up. They will be more interested in that rather than whatever the teacher is telling. So they will again appear as poor scholastic performance. So in spite of having good intelligence, so once you will start talking with them, you will see, oh wow, they have so good thought process, their thinking is good. If you make them learn anything, they will learn, they will reproduce that thing. But once you just leave them and tell them, okay, I'll be coming in next 15 minutes, you complete this paragraph, 2 minutes, they're over and out. They will just be moving their pencil all around, their eraser will fall, they'll pick up the eraser, they will just rotate the board, they will rotate the desk, they will rotate the copy, but they will not write. And once you will come back after 10 minutes and say, okay, what were you doing? Just start writing once more. And then they will start writing. Again, you are out and they will be lost again. The attention span is not good. And in spite, again, of having a normal intelligence, good intelligence, they won't be able to appreciate what the other person is saying, what the other person is talking, what the other person comprehend. They just cannot comprehend also. And sometimes these children are diagnosed as absence epilepsy or absence seizure. Because in absence epilepsy also, the children just go zong for a few seconds, then come back, zong for a few seconds, then come back. And because they go zong for a few seconds and then they come back, they again appear as or present as poor scholastic performance. Poor scholastic performance means not doing good in studies in spite of having good normal intelligence. So those are the differential, and we have to make sure what my child has, because then only you would be able to treat it. So, and these features present at a later age, maybe 8 years, 9 years, because once you are a small child, you are small, so you there's not much to learn, and because their intelligence is normal, so they don't face any difficulty. They learn it, they speak out. But as the age increases, the course increases, the syllabus increases, and then bang it, they are unable to cope up. And one most important thing is that whatever they like, they will do with full attention. With full attention. So the mother will complain, how can you say that he's not interested or he does not have attention? Because he can watch television for 4 hours together. He could play on a mobile for 4 hours. He can draw. His drawing is wonderful, and he can draw for like 6 hours at a stretch. He will not move until and unless the drawing is completed. you know so the problem over here is, because they don't have interest in that, they would not be able to concentrate there, and maybe in studies. But when whatever their interest is, they are very good at. And also their transition is very slow. Suppose you are writing and the teacher says, okay, just close the book and start reading. So they will take a while to comprehend that command, and from writing to reading, the transition they are not good with the transitions. They cannot do the transitions very well, very quickly as compared to other children, because they think about it and then they comprehend it, then the processing happens, and then by the time the comprehension happens and they are going to do that, the teacher is on another command. The teacher says, open your bag and take out social study book and start reading page number 19. So they are lost. And once they are lost, and then they don't want to come back. So again, these children also, you have to understand that in spite of having normal intelligence, they are unable to perform. They are very good vocally, they are very good thinkers, but the parents think, ये तो बदतमीजी कर रहा है, he just doesn't want to. But it is not just want to, it is they cannot. Okay, so once you know that these features are there, you have to get it tested. So what are the testing things? So we have like certain diagnostic criteria, like for ASD, autism spectrum, you have DSM-5. So again, for ADHD, we have got DSM-5, where we know if the child fulfills this criteria, then we can label him as ADHD, and also would be able to tell you which type it is. It is a hyperactivity type, it is inattention type, or both. But mind it that you always have to refer to a concerned person to find out that these ADHD are not secondary to something. So as I mentioned, absence epilepsy, sometimes our children had absence epilepsy and they were treated by the psychologist, diagnosed as inattention because of poor scholastic performance, and they were just given treatment, behavioral therapy and medication for ADHD rather than treating it for absence epilepsy. Similarly, I've seen children who were diagnosed as hyperactive type of ADHD because the child was running all over, but the diagnosis was something very different. It was a genetic adrenoleukodystrophy. It was a very different diagnosis where the child just presents with hyperactivity, but it is not just plain hyperactivity. So that is why it becomes very important to find out whether my child, first of all, has symptoms of ADHD, as I have elaborated the symptoms, or whether this is secondary to some cause, or what is the cause. The child may have very refractive error, and because of that he is unable to see the blackboard, and because he is unable to see the blackboard, he would not be able to write, and the teacher would think he is not interested in writing, and maybe he'll just score him very less. So there are various causes of having a child inattentive or hyperactive, and you have to consult your doctor to find out what the cause is. And suppose if you don't find out the cause, his vision is normal, his hearing is normal, his IQ, intelligence is normal, but till he's unable to perform, then we do this ADHD profiling. And then when the symptoms are met and we follow the diagnostic criteria, if they fulfill the diagnostic criteria according to DSM-5, we say, okay, this is ADHD. And then also again we want to find out the cause, whether this is primary or secondary, and if there are no other symptoms which can lead to this type of symptomatology, then we label it as primary ADHD. Okay, so I think that's all for today. And we knew that what today in this talk, we knew that what ADHD is, how do we diagnose that, and in the latter half, in the next half of the other part on next Wednesday, we'll talk about how to treat this. Okay, so I'll go to the questions and find out if there are any questions are there. Okay, so hi Jitendra. So Jitendra is writing, my son is 3-year-old. He demands everything verbally, but he does not describe any incidents or situation. He answers when we ask him something, but not self. Attention आने के बाद observation आ जाता है क्या? What do you do for improving observation? So, over here, the child demands everything verbally. So, he's verbal, but he cannot describe an incident. To describe an incident, you have to have a good observation and good intelligence. So I don't know, because his verbal thing is good. So that means he knew the need-based things or whatever he knew, but he does not know how to describe, because description involves a lot of thinking, a lot of thought process, a lot of abstract thinking to find out the correct word, and then also the correlation. So yes, I agree to that. Attention, after you get the attention, observation definitely increases. But find out whether this is just inattention or he has also certain concerns with cognition or intelligence. Okay. So, and what you do for the improving observation, you have to talk to your child. Again, with these children, we have to make sure that we spend a lot of time talking with them, explaining with them, understanding them. Also, I will tell you in the next session what to do, because that part would be dealing with ADHD. Okay, how to deal. कविता, मेरे 3 ईयर के बेटे को 9 मंथ पहले रिग्रेसिव ऑटिज्म डायग्नोस हुआ था. अब वो हमको वर्बल रिस्पॉन्स देता है पर कम्युनिकेशन नहीं करता, बच्चों में मिक्स नहीं होता है, एंड मीनिंगलेस स्पीच इज टू मच. सो व्हाट आर यू डूइंग विद दैट? कविता, आपका डायग्नोसिस हो गया है, बट आर वी डूइंग सम थेरेपी? Because regression आया and then I have to make my child go up again. So if I have to make my child go up again, I have to find out and I have to help him out, because the case of autism. So what are the things? Do we have sensory concerns, or we just have the regression? And also, what was the cause of regression? We have to rule out that. So have you done an EEG? Just make sure you have done an EEG. Also, if there are no sensory concerns, then you can go for ABA therapy. And if there are a lot of sensory concerns, then you have to go in for OT therapy. If the child becomes better with occupational therapy, then we have to add speech and special education. And if you're giving ABA, that in itself is a complete comprehensive plan. You can continue with that. Okay. Hi, Utpal. Is ADHD is a condition of a mental retardation? No, no, no. So ADHD and ASD has nothing to do with mental retardation. I've already told you that in ADHD, the intelligence has to be normal. If it is associated with intellectual disability, then also you can have hyperactivity, but that is a different scenario. In general, all those children who will just label as ADHD, most of them have normal intelligence. So if you have Intellectual disability, we don't use the term mental retardation now. It is very, it doesn't appear out to be that great. So we say intellectual disability. So if the child has intellectual disability, yes, the child could have some component of hyperactivity, but that is because he's unable to understand and comprehend the commands, and because of that, he's hyper and all over. Okay, but definitely ASD, in fact, 10 to 15% of the children with ASD has savant skills. That means they are super, super, super intelligent. ADHD in itself, primary ADHD, does not have anything to do with intellectual disability. And intellectual disability in itself is a different entity. हाय सीमा, मेरा बेटा 2.5 इयर्स का है, उसको डॉक्टर ने बोला है ऑटिज्म है, वो गुस्से से सर भी बहुत पकड़ता है और दांत भी किटकिटाता है, उसकी ओटी थेरेपी चल रही है और स्पीच डिले भी है, क्या वो ठीक हो सकता है? I cannot tell you because I am not there. These children have varied trajectories of improvement, but yes, definitely I can tell you this much, that he would be better each passing day with therapeutic interventions, but till how much that child will reach, I don't know. ठीक तो होगा, डेफिनेटली होगा, बेहतर होगा एवरी डे, बट हाँ, आपके जितना ठीक हो सकता है या फिर जो है जो उसकी उम्र के बराबरी वाले बच्चे हैं उनके जितना ठीक हो सकता है, दैट आई डोंट नो. So, Mehru Asim. Hi, Mehru. I'm from Pakistan. Meaningless speech and touching others' nose. Also, verbal, meaningful speech is present. So, Mehru, you have to tell me the age. If a child who's like 2 years, if he is doing that, I'm not worried. But if a child, if this is a like 5-year-old and still he is doing that, I'm very much worried upon. So, I need the full history and also the age. So, Jahana B. Gogai. Hi, I'm from Assam. My son, Pradyum, 5 years old, improving than before. He started 1 to 2 words for communication, but self-talking still. Thank you for your treatment. Yeah, I could remember you. So, whatever you are doing beautifully well. Staying at Assam and doing so well, I'm so happy for you. Because if he started communicating 1 and 2 words, definitely he is going to improve. Okay? If he has still self-talking is still there, the only key is distraction. You have to distract the child, and distract the child while he is doing self-talking. So for good eye contact, again, you have to distract and take him into, you have to talk with him a lot. I know you're doing beautifully well because speech has already started. So I think he should improve. Okay. So Vaishnavi. Hi Vaishnavi. मेरा बेटा लव 5 साल का, वो राइटिंग के टाइम पे कॉन्सेंट्रेट नहीं करता है, देखता कहीं है, कहीं ना कहीं ऑनलाइन क्लास में कॉन्सेंट्रेट करता है. सो okay, so please get him tested for कि जो है why he is not writing, what is the diagnosis. If your child's match with the symptoms what I have told you, maybe he could have ADHD inattention type. Okay, so please make sure what the diagnosis is. So, hi Mehru. Yes, my son has normal IQ but has hyperactivity. Okay. So for hyperactivity, he's 10 years old. So for hyperactivity, what we do is like, although I'm going to tell you in the next session, but okay, for Mehru, we would just tell about that you have to deviate his energy, you have to expedite his energy, you have to make sure that this extra energy, whatever he has to be channelized. So what you have to do is like, first of all, decrease the sugar content. If the child is eating a lot of sugar, please decrease that. Decrease the preservative food. If you are having a lot of junk food, empty calories, please just decrease that. Third, tell the child that you have to try to expedite the energy, make him join some sports activity, maybe some football, maybe some skating, bowling, something where his extra energy just goes off. Because if his extra energy would stay, then he would just do all type of tantrums and will behave awkwardly. Also, you can start with occupational therapy because a bit of the children who have got hyperactivity have a bit of sensory concerns also. So make sure if the child has a bit of sensory concerns, occupational therapy is really going to help him. Next, for the sports, I've already told you the sports, but swimming is a very good sport. Please make sure that you put him to swimming because swimming really helps out to take out the energies and helps the child be better with his sensory concerns also. Also, don't let your child with hyperactivity join judo karate classes because they will learn all these things and they will apply on other children, and that is not good. So also, what you have to have, you could also have behavioral therapies. So if the child stays for 2 minutes and do some work, then you're going to give a star. That is what you call as positive reinforcement. You could use positive reinforcement. You can also make a chart in the room that, okay, if you have done this, then I'm going to give you 2 stars, and also I'll take you for a small ride. So you have to ask him for the positive reinforcements. Also, you also have to be very patient with your child. You have to sit with the psychologist and learn that even if the child does things, you don't overreact on the child. So this all I'm going to talk about in our next session. So you can definitely join, Mehru. You can definitely join, but these are the tidbits which I've already given you. Okay. So Jitendra, what to do for cognition improvement? So first you find out why the cognition is low, whether this is thyroid concern, whether this is some genetic concern, or whether this is just without any cause. So once you find out the cause, then we treat the cause. So if it's thyroid, we treat him with thyroid medication. If it's some genetic, then we just start him with ABA therapy and with therapies, so that repeat the things again and again multiple times. If my child learns it by 4, maybe your child will learn by 8 times. So you have to do it multiple times. Also, the approach has to be right. Okay? Because if you'll start with ABCD and he doesn't know even the basics, then you have to go to the basics. If he doesn't know the pointing, if he doesn't understand the concept of ABCD, and you will just start making him do ABCD, he won't learn. So you have to know what your basics are, where your child stands, and once you know where your child stands, you can build up on that, if even with the low cognition. Okay? Hi, big man. So I'm Yusuf. मेरा बेटा 5 साल का है, स्पीच डिले है, थेरेपी हो रही है, पॉइंटिंग करता है, कमांड फॉलोइंग है, बट आई कांटेक्ट भी है, बट स्पीच थेरेपिस्ट कह रहे हैं आईज बंद करता है. मैम ये ठीक तो है? आईज बंद करना आई स्टिल डोंट नो. आईज क्यों बंद करता है? क्या वो सेंसरी कंसर्न्स हैं उसके, विजुअल सेंसरी कंसर्न्स हैं जिसकी वजह से वो आईज बंद करता है? कहीं जो है कुछ बार बार ऐसा आईज बंद करके कोई सीजर्स वगैरह तो नहीं है जिसकी वजह से आईज बंद करता है? प्लीज यू हैव टू चेक दैट. सो दिस information tells me of 2 differentials, and you have to check for all these 2 differentials. So again, Komal, my child is 4 years and diagnosed with IQ issues, that means cognition. How can we improve his speech? So I have already told somebody how to improve for the cognition. So Komal, you have to, whatever I have told you before for Jitendra, you have to follow that. So you have to find out the cause, and if the cause is treatable, treat it with medication, treat it, or else start with therapies and which understand and start from the basic. And for these children, ABA works beautifully well. Applied behavioral analysis therapies works beautifully well. Okay? Okay. आई वैष्णवी मैम, लव का डायग्नोसिस ADHD हुआ है, उसकी टैबलेट एक्सेप्टा 10 मिलीग्राम वाली 1 टैबलेट डेली एंड ब्रेन मैक्स चल रही है. सो हाउ इज ही डूइंग विद दैट वैष्णवी? So because that is the medication which we use for ADHD. So if the child is improving, that's very good. Also, you have to start with some therapies also, and make sure if this does not suit You can try another medication. If this suits and still the results are not that great, you can increase the dose according to the weight in consultation with your doctor. Okay? So, Amrit, my son is 2.5 year old. Good eye contact, follows command, very good. Solve shapes, puzzles, babbles, some words we can't understand. Chart, MChat. MChat says low risk but no speech, confused. So MChat says low risk, but we have got the symptoms. So these screening tools are not 100% sure of. They are just, they tell you, okay, could be, could not be, because these are screening tools. So, but once I know that his speech hasn't come in because he's following command, he solved puzzles, see? So that means we can start with the speech therapy right now. Okay? Because eye contact अच्छा है, command following अच्छी है, that means autism वगैरह नहीं है. Intelligence अच्छी है because you say he solved the puzzles, shapes, colors, everything. So once if it's like this, then I think that we have to start with the speech therapy and put the child in the school. I think that is what we want. Okay. So I think we'll go to Hina. Hina, my daughter diagnosis is GDD, that means Global Developmental Delay, and autistic behavior at 10-month-old. Now 3.9 years, OT is continuous from last 3 years, still IQ is low. 2 seizures आ चुके हैं. Okay, so because GDD is the diagnosis, so once you have the GDD diagnosis in the earlier years, so what I've seen is like later in their life, they have a bit lower IQ. So again, you have to just check upon what's the cause of the GDD. Like you must have done the thyroid genetics and all blah blah. If that has been done and ruled out, again I'll go to the same thing which I have answered for other people, that for the low intelligence you have to start with the therapy, not OT now, go to the ABA therapy, because ABA basically is a school and there is like 1:1 therapy happens, and they know the baseline where you have to start with and then they slowly build up. Okay, because right now you said that it's just IQ part which is remaining, so obviously sensory concerns must have gone, and because the sensory concerns have gone, OT is not now going to help you in a lot better way. I think schooling and ABA therapy is what is going to help the child. Okay, so we'll go up and find out Utpal Malik, 2 years 10-month-old child. We are giving running commentary, but still then only few words he tell. We give him swing, but now he is obsessive for swing. I did not understand the question, Utpal. I don't know what you are talking about. Okay. I think I've answered all the question. So I think Mehru again have said something. Also, he touches others, like after a long day, if I pick him from school, he looks lost and confused. He's little hyperactive and confused. Then I give him trampoline. Okay, so I think we have already answered these questions, that maybe he may have some sensory concerns, so tackle with that, show to a doctor and find out what basically it is. So we have to find out, because you said intelligence is normal. So I think hyperactivity or inattention could be there. So you have to get it checked get the psychological evaluation done and find out whether this is ADHD or not. Because what you are telling your child, intelligence is normal, but he is doing all these weird activities. So I think you should check it for hyperactivity. So, Shashikant, hello, my son is 4-year-old. He's following all instructions, not just able to complete sentences. With ABCD, always tell us with example numbers. Also tell us more than 100 he's able read and write. So we did his DQ testing, doctor. He's in moderate level. Okay. So again, moderate level, I think you should start with some therapy. Okay, you have to start. So, schooling is really going to help you. Therapy is really going to help you. And which therapy? It is ABA therapy. ABA therapy really helps because, again, the same thing. It'll start from the basic, build up. It is 1:1 therapy. Also, if you just send him to school is basically like a group therapy, 4 or 5 people, one teacher, and maybe for everybody the command is the same. Whereas in ABA therapy, the command is different, the child is different, only 1:1 therapist and one child. So that's why the child improves wonderfully well. Okay. So I think I've answered all the questions and no more is left. And with that, we would like to end the session. Hopefully, you have understood what ADHD is, how to diagnose that, and thank you for listening, for patient listening and participating. Thank you so much for sparing the time, and stay blessed. Have a lovely have a lovely evening and good night.